Hi there, my name is Andrew Thompson. I'm a grade 12 student at Rumdale College Senior High, and over the past summer I was paired with Dr. Tarun Chaudhary in the Department of Family Medicine through the HYRS program, which is run by AIHS and the university. And we both worked in the area of immigrant and refugee health issues, and I specifically worked on immigrant and refugee health awareness. And so I really wanted to make this video to talk about some of those issues because they're not really brought up in the media on a day-to-day basis. And so I'm actually going to start on the immigrant side of things with something called the healthy immigrant effect. And this is an effect that has been observed in multiple countries, not just Canada, and it basically describes the phenomenon of immigrants coming to a new country, being healthier than their native counterparts, so having a lower BMI, lower rates of disability, and lower rates of alcohol and substance abuse than the general population. So a better overall health in general. And a large part of this is due to something called the comprehensive ranking system used by Citizenship and Immigration Canada. And basically what it does is it awards more points to applicants who are younger, have a lack of a criminal record, have a lack of substance abuse history, and are generally more likely to be healthy when they arrive in Canada. And so that's why they're healthier when they arrive. But then 10 to 20 years later, their health plummets compared to the native population. They're not only below par with the native population, they're drastically below par in terms of health levels. Which is really intriguing because these people come to Canada and they have a higher level of health than the native population, but then 10 to 20 years later, it's no longer like that. And so, you know, as primary care providers, we have to be wondering why. Why does that happen to this specific group? And all of that has to do with the issues that face immigrants when accessing the primary care system. Three that I really identified strongly with and that I'll be elaborating on today, there are many, but the three that I think are most important are the language barrier, the cultural stigmas, and a lack of understanding of them, and the fundamentally different needs of the immigrant population when compared to the native population. So let's start with the language barrier. Why is this an issue? Many immigrants who arrive in Canada do not have English or French as their first language. I believe the statistic was about 1 in 5 Canadians do not have one of those as one of their speaking languages. So oftentimes they have to rely on a translator when accessing the primary care network. And this is often in breach of confidentiality, and it can make immigrants feel that their needs aren't being met by the primary care system, so they're going to be less likely to use it in the future. And then if we look at cultural stigmas and a lack of understanding of them, a specific example that comes to my mind is mental health stigma in South Asian cultures. And so in a lot of South Asian cultures, mental health is quite a taboo topic. So when they arrive in Canada, and if they experience, you know, significant mental illness, it can be hard for them to willingly to seek help because the primary care system currently doesn't address that specific stigma, and so these people often feel uncomfortable talking about mental health issues, and our primary care system can't really do anything about that because we don't know right now how to address those stigmas as a system. And the final point that really identifies what the issue is with immigrants accessing the primary care system is the fundamentally different needs that they have. So an example I'm going to use is that, you know, every grade 5 student in Alberta goes through a month of nutritional programs and, you know, reading how to read the Canadian Food Guide and whatnot. But this is something that a lot of immigrants who arrive in Canada don't have. And so when they arrive in Canada, they're not necessarily able to make the best nutritional choices for them, which contributes to that higher BMI that eventually arises after 10 to 20 years as part of that healthy immigrant effect. So if we could address that, that might remove the BMI part of the healthy immigrant effect. That's just a little tidbit to think about. But why does this really matter to the Canadian population as a whole? And it's due to the fact that Canada can be portrayed as a mosaic. A mosaic is a painting that is made up of lots of smaller pieces of art, and you have to have everything has to be equally polished in order for you to see the full picture. And I think of Canada as like that. We have a lot of different subgroups in Canada, but in order to be able to be the strongest and most complete Canada that we can be, all our subgroups have to be equally polished, equally healthy, in order for us to be the best Canada that we can be. And so that's why immigrant health, is something that should matter to all of us, because in a mosaic, every piece paints the picture, right? So we have to have these immigrants on par with our national average, or better, because they're arriving with a higher level of health. And so, if that's something that we can maintain in the future, that would be something that would strengthen Canada as a society drastically. And so how can we solve these issues? And the thing that springs to my mind is, let's work as a community. That's what's made Canada great in the past, and it's what makes Canada a powerful nation today. And that's our willingness to work together as communities. And so when I think of how we can address it in our communities, I think, okay, there's champions, which are people who really believe in the problem. They're not the people who necessarily hop on right away and want to do, I can have 35 hours a week to work on it. It might not necessarily be those people. It's the people who truly believe in the work you're doing and the problem is real. Those are the people who we need to target first. You need to target the champions, get them to believe in your cause. Then we can identify directors within the community. These are people who are really good at organizing the people in the community and saying, person X has strengths here, so we should get them to do this thing. Those are the people that we can target next, and the champions can help us identify these people and motivate them to be part of the cause. And the last and most important group, in my mind, is the effectors. The effectors are the people who make the change happen. These are the people who the directors tell what to do, and the champions make them believe in the problem. And these are the people that get the changes done. And so, if we look at what the roles of those effectors are in terms of immigrants in the community and primary care providers, if we look at immigrants, they can learn about the primary care system and understand how to extract the most from it and prevent undue hospitalization, which would boost the health of immigrants in the community, and therefore, using that mosaic effect that I described earlier, boost the entire community of Canada. If we look at primary care providers, they can learn the unique needs of immigrants in their community. They can, by speaking directly to immigrants, they can learn better than any of my videos ever could, or any video or any educational format ever could. Speaking directly with the population that you want to work with, I think that's the best method for primary care providers. They could also learn about the cultural stigmas that face immigrants in their community and how to deal with them on a professional level. And then they could also learn how to effectively communicate with immigrants in their community, recognizing things like the language barrier that I have already discussed. And that really would strengthen the bond between immigrants and primary care providers within the community. And again, using that mosaic effect, it all comes back to that. Using that mosaic effect, it strengthens the entire community. Moving on to refugee health, it's important to make the distinction between the two problems. Oftentimes in the media, we hear refugee health and immigrant health as terms used interchangeably, but really they are not. Refugees are people who are forced to move away from their home country, while immigrants in most cases choose to move away from their home country. So that leads into the different kind of stresses that we see on their health. With immigrants, it's more long-term, adapting to a new environment, new society, whereas with refugees, it's a lot more short-term. and often this can cause mental health issues within the refugee population. In Texas recently there was a study done where 26.8% of respondents who were refugees said that they felt that they were experiencing mental distress, and 50% of them requested immediate mental care. So that's a big number, 50% of these people want mental care. That's a number that we as a society can't ignore. And so when we use the terms refugee health and immigrant health interchangeably, we kind of do these subgroups a disservice, because we're not recognizing that there are different needs between these two communities. And so that's why, as a society, it's really time for us to stop classifying immigrant health and refugee health as one and the same, because at the end of the day, they are two really distinct problems that don't require the same solution. And as of right now, there is a lot of research that has been done into the healthy immigrant effect, but as to what to do with refugees, more research needs to be done to see what methods work with large populations of refugees, because a lot of studies are focused on individual case studies, but not so much on a large scale of refugees. And so that's something that potentially could be a future direction for anyone out there. I'd like to end with a quote by American civil rights activist Cesar Chavez, which reads, "We cannot seek achievement for ourselves and forget about progress and prosperity for our community. Our ambitions must be broad enough to include the aspirations and needs of others, for their sakes and for our own. So, for our sakes and for Canada's sake, let's not forget about the aspirations and needs of immigrants and refugees in Canada." Thank you.